I, for one, am not embarrassed that this is our 12th attempt.
I mean, I think it's hilarious because this podcast is already done. This was a completely, all this redo was 100% optional, which I think is pretty funny
It's
when you
not
Katie
really
didn't
really.
even
think
know.
about it.
Katie just like she was completely not present. She
Yeah,
just
she was just
completely
like,
zoned out. She left the room. She was hearing body only.
yes,
True.
Right?
it's totally
Where'd you
true.
go, Katie?
I don't even know. An alien came, took my brain, and took me somewhere else just for that brief moment.
But this is going to work now.
I mean, it feels like we've figured it out. I guess from now on, it should be pretty quick. We have the workflow set up. We know how we did it, right?
Right. Theoretically.
And we should just be able to like plug and play every time, I think.
We have to go forward with the notion that this worked and this is going to work from now on.
Yeah.
And so
Yeah, I agree.
we have to harken back to 6 or 8 weeks ago when we
Right.
tried this the first time. Right.
Exactly.
So, all right.
All right, let's do this.
Hi, I'm Ari Haberberg. I'm a filmmaker here in New York. I'm here with Dr. Vishal Thanik and Dr. Katie Weichman, who are my close friends. And, well, Vish, why don't you explain why we're here?
Well, we're here because we have been talking for a long time about sort of issues that we, as all people do, right? We talk about the issues that are important to us. We talk about the issues that are worry us or bother us. And we've been talking about a lot of things related to healthcare, and, patient care and all those things for a long time. And it always is a recurring theme that comes up. And we decided that this might be a really interesting podcast for people to listen to because we think that we have a sort of interesting perspective that may be helpful for a lot of people who need to travel in these worlds.
But how did we, I guess the thing we should explain is sort of how did this come about? How did we come about with Outside the Loops? What does Outside the Loops mean?
Yeah. So outside the loops is a phrase that came up. It's, I guess, it's not a metaphor. I'm not smart. What are the words? What would you call that? It's not a metaphor. It's a
Simile?
simile, Katie?
I don't know. Play on words, maybe? I don't know. It is a metaphor. A simile
metaphor.
is
Yeah.
like.
I mean, it is a metaphor.
It's a metaphor.
All right. So we are plastic surgeons and we are microsurgeons. Microsurgery is a technique, a tool that is utilized in which we take tissue from one part of the body and we move it to another part of the body. So in its simplest terms, what that means is we take an area of tissue. Every area of tissue is supplied by blood vessels. We take the tissue along with its blood vessels. We get down to a larger vessel. We divide it, and then we move it to another part of the body. In that part of the body, we find a blood vessel that we can use to put blood flow in and take blood flow out, and we connect them together under a microscope. So we use either loupes, which are magnifiers that we wear on our face, or glasses with the little telescopes that people have probably seen. And then at some point in microsurgery, we often use an actual microscope, but both are magnifiers. So the loupes are the magnifiers that we wear on our face. And we use this when we're harvesting the flap, when we're getting the flap and taking it out. And so the great thing about loupes is that you can see really magnified. You can see things that are small up close and you can see them really well. The downside is that when you're looking through your loupes, although you can see with good magnification, you lose perspective. Your field of view narrows substantially and there's only so far that you can see. So in a case that we were doing, I was talking to one of the residents about this idea of being sure that when you're using your loupes, you can't always stay focused in the loupes. You have to look outside the loupes and maintain your perspective, the greater perspective of what you're doing and the case. And I was saying, like, this is what we're doing with our physical hands, but metaphorically, this is what you also need to do with your mind. And he said, my resident, who's a great guy, full credit, Carter Boyd, said, I think that would be a great name for a podcast. And I was like, and we had not been talking about the fact that we were going to start a podcast. So And that's where I called Katie. I was like, this is a great name, because it is exactly what we
It
want to
is.
do in this podcast, right, Katie?
Exactly what we want to do. I think we haven't really touched upon what we are going to address in this podcast, or like why what's it about. So it's mostly going to be about issues that we have seen in our patients and ourselves that are causing people not to thrive and to be sort of in a state that is not as good as they want to be, while they may be cured from their disease or having and doing well from that perspective. They just don't feel quite like themselves. And I think this is a problem that a lot of people have, not just people that are going through illness, but people just in the country and the world right now.
Not thriving.
Not thriving.
The medical system is challenging. I guess so. If I could just sort of take a step back and say, like, the point being is that, we talk a lot and we complain about our lives and our jobs and the way things are going and the way the world's going, and and we touch on a lot of topics, and very often that's medicine, and so
Unfortunately, we are unable to keep our work life away from our dinner conversations.
which is great, because no, I mean, there's a lot to talk about, and so this metaphor of outside the loops is the idea of being able to see beyond what is driving a lot of the decisions in medicine,
Yeah.
and sort of being a better informed patient,
Yeah.
in this way.
Yeah.
So the purpose of this, and I don't speak out of school here, I don't speak for you guys, but the point of this is to create a body of work that can be a resource,
Yeah.
for patients who are going through something, and they can access this not unlike a series of encyclopedias or episodes about specific topics that will be available, that will speak to the thing that they're struggling, so that they're more likely to thrive outside of their treatment. Is that
And more
correct?
likely to be able to make better informed decisions, ask better questions to their providers, their doctors, and to just have a better perspective on what's in front of them. Like, more information helps, and we can help sort of predict maybe some roadblocks and things that may be challenging even for us within the healthcare system, who know, like, our insiders, sort of give personal experience from the physician side as well as a patient side. I think both of those things will provide a unique perspective that could be valuable.
Mm-hmm. I think it also helps. I'm just going to say, as Vish was saying the other day, you are a very empathetic person, and you're
The most,
right?
Undoubtedly,
Like, to a fault.
I'm not gonna comment on that.
It's an asset. Ultimately, it's an asset, even though it can be challenging for you. And I think that's the important element that you'll be bringing to this conversation.
I hope so.
But we didn't just decide to, come up with. We didn't suddenly decide to come up with a podcast. You, Katie, had some experiences that made you realize some things. Can you maybe speak to that a little bit?
Yeah. So about 4 years ago, unexpectedly, I was diagnosed with breast cancer, as unfortunately many women are. 1 in 8 women in their lifetime will be diagnosed with breast cancer. And unfortunately, in current times, it's being diagnosed in younger people, and in younger people without family history. It's just on the rise, and maybe even closer to 1 in 7 people. So it's not an uncommon story, but it was a surprise to me, as I think it's a surprise to everyone when they receive that news. And I thought that I would be able to handle it better than I did, because I know, like, this is what I do. I care for breast cancer patients. I do breast reconstruction. But I wasn't able to do it, and I experienced some challenges that I wouldn't even have thought about. And it just gave me a lot more perspective. And I thought at the beginning of this that I really understood and tried to empathize with my patients, as you said, but there was some things that I just didn't know could possibly happen because it hadn't happened to me. And having had that experience, it just gave me a lot of clarity and a lot of insight into what other people may need during this process.
Well, I think we thought we were the perfect people to go through this, right? Like we are, I mean, what I would say is there's very few people whose background experience makes them better suited for going through this, right? So we both did general surgery residency. So we did like a full residency in general surgery. So we're fully trained on the oncologic side, the breast surgery side, all of that. Then we're trained in plastic surgery. We're trained in microsurgery, and we take care of breast cancer patients.
And you've been doing this for
yes, and we've
years
been doing
and
this
years
so
and years.
and so we've been doing this for like over a decade. So we are used to talking to the oncologist. We're used to talking to the radiation oncologist about our mutual patients. So all of these experiences, like soup to nuts, this is like our day-to-day life. So no part of us were like, oh, this is going to be easy. But we were not prepared for, I think, the level of just challenge and difficulty. And what I think was so interesting is that it came back to this thing that we've always been talking about of, in this siloed world of medicine that we live in, I think people are hyper specialized and people very much stay in their lane. And you realize that there's no person in the mix that's sort of there to sort of bring it together or think about the stuff that's outside of their thing. And a lot of these things that people, when we talk about like surviving for thriving, like all the people's lanes and all the specialists are really good at the survival part, right?
So good.
Right? So good. It's
And
like
better and better every year.
And better and better. Like so good.
We made massive improvements in that, right? Like that's for sure. But the stuff that is the difference between people like surviving and really feeling like amazing are these things that don't fall into anyone's bucket. Like it's not an obvious bucket. And so these are the things that are just like falling to the sides and there's no obvious person to pick them up and talk to people about.
And I think even if people want to, like I would say a lot of physicians want to talk to the patients about that, but there are pressures that limit the ability to do that and the time to do that with constraints of seeing so many patients and the demand and charting and just all of those things make these conversations which are first of all time consuming, and there's not a lot of good answers or resources about them, and it's more nuanced, and I think it's harder to integrate into the practice, especially for busy people.
Yeah.
And honestly, physicians just need to see new patients, a lot of new patients. There's a lot of pressure from the health systems to see new patients. The follow-ups often get, just pushed to survivorship very soon. So I just think it's an area that we could improve on, and it's not the fault of anyone, but it's just an area for improvement that we noticed.
It doesn't seem to me like it's falling between the cracks so much as a situation where on the edges of every specialization is a vagary. Like I could talk to him about this, or the oncologist could talk to him about this, or the whomever could talk to them about this, and no one agrees.
Or some degree of thinking that somebody else
is talking.
I guess that's what it is.
Because we do. Right. I'll say to sometimes people like, "Has anyone talked to you about this?" And they'll say no, and I'll say, "That's like I thought somebody would." And my intrinsic thing inside is to say like, "Oh, I thought somebody would have some other person in this team is going to be talking about that." But you realize a lot of it doesn't happen that way.
Yeah, there's no one central person that's in charge of the care. There's so many different people.
Fragmented.
It's so fragmented. Even though we're connected more than ever.
And fragmented, right?
Yeah, and it's connected more than ever. With electronic health records, with all of this, it's so connected and you're able to communicate. But somehow
I get my test results on my phone. It's incredible.
Yeah, it's incredible.
I feel very empowered as a patient.
It's incredible. There's pros and cons to it. I think it's definitely incredible that.
Well, then I go Google it and I find out that I'm dead. Again.
Highly problematic.
It's problematic for sure. It is definitely problematic.
So we're going to spend the rest of this season discussing the process and the experience of breast cancer. And our goal is to cover those gaps and help people with the spaces in between their experience and their choices.
Yeah.
Is that a safe
Yeah,
way to
we see it
describe
as like a library of episodes for people who are going through this, or their family or friends who are going through it with them, where with each step of the process, each visit, each part of it, we'll have an episode where we talk about what to expect in that stage, what to expect when you go to the doctor, like what are the what are the things you should be thinking about, what are the questions you should be asking. And then I think very importantly, the thing we notice the most is in every step, there is going to be some roadblock, something you have to fight against, something you have to think about, and what, like, some challenge that is going to befall you. And I wish that wasn't true, but there is. And trying to prepare people for, okay, what is that? And what's the best way for us to get through that and maximize, right? Because
Yeah.
that's what we found, right? I think in every step.
Yeah. And I think what Ari said, the word empower, that he feels empowered with his health record. We hope that this information can empower people to ask the right questions, advocate for themselves, which I think you have to do in the health system. You have to always advocate for yourself. You do. And it just is. And I wish it wasn't like that, but you do. You do. And sometimes you have to be annoying, and sometimes you have to push, and sometimes you really have to ask things for yourself that you may not feel comfortable with. But I think it really helps.
Definitely. I mean, I think the challenge in terms of the first challenge in terms of advocating for yourself in the medical system is knowing what to advocate for or how. Like, and I guess that's the point of that's why we're here. To indicate those things. You might hear this, or you might hear this. This is this, and this is another thing. But be sure to get this, because later on, is this
Yeah.
That's what we hope.
right?
That's what we hope.
That's our goal.
Totally.
All right. So our first episode is coming up, and it's going to be covering
I need a mammogram.
I need a mammogram. All right. Well, I look forward to the conversation. I think it's really going to be interesting. Thanks, you guys.
Thanks.
Thank you.
All right.
Cheers.
Cheers.